The breakthrough in healthcare, the reason why we haven't had a massive breakthrough in healthcare is because when I say we, I mean those involved in the healthcare industry, because I'm not involved in the healthcare industry myself. The healthcare industry has been focused on improvements to a bad model. That's why, you have almost exponential continuing growth. It's like education, healthcare funding keeps going up and up and up. Most computing, the price keeps going down because of Moore's law and it becomes more efficient. But what is this broken model and what's going to replace it? So the broken model now is to pay, is an emphasis on services, diagnosis, specialists, testing. So it's a real medical model, which is not surprising for healthcare, but it's an emphasis on basically on sickness. And when you have these symptoms, you get these tests, and when you have these symptoms, you go to this specialist. There's a much better model, and it has several components. One is a value model, one is a systems model, one is a holistic model, one is a personalized model. I'll explain how these all come together. So when you pay for sickness, then you get more sickness. I mean, that might sound simple, but when you pay for tests, you get more tests. When you pay for specialists, you get more specialists. So it's really a incentive-related problem that we're paying. We're pricing the model for tests. So surprise, surprise, we're getting more tests. We're pricing the model for specialists. So surprise, surprise, we get more specialists. What is the alternative for that? So the alternative, it is also ration care that, if you get, a certain amount per client, per patient, then you're going to, want to do as little services as possible. So if instead we paid for treatment outcomes, it would be a game changer in a number of ways. So if we paid people for how healthy, if we paid medical providers for how healthy the patients were, then first of all, it would align the incentives that instead of just being paid more for tests and paid more for visits and paid more for specialists, irrespective of whether that improves a customer's health or not, if they were only paid for health, then everything that the medical professionals did would be geared towards making people healthy. It would be a lot of preventative care to make sure that people don't get sick in the first place, because it's much easier to keep people healthy than to try to get them healthy again. And it would create a more holistic picture, because it would require integrative services. Because in order to keep people healthy in the first place and to help them regain their health, you can't just focus on one little test or one little thing. You have to work with the whole person. It would become person-focused, because doctors would have to listen a lot more. See, doctors don't need to listen now, because they can get paid just for giving this test, giving that test. Doesn't matter what the patient wants. Doesn't matter if the patient's healthy. So it's an economic misalignment. If you're only getting paid for keeping people healthy, and the degree of health determines the degree of money that you receive, then you got to start actually listening to your patients. What a radical idea. Doctors that spend extra time, doctors that ask better questions, and that is, there's a lot of studies that show that the relationship with the doctor is a key component of, may actually be the primary component. I'm not sure if it's the primary, but I know it's one of the most important factors in a person's health is how good, because people that don't have good relationships with their doctors or feel that the doctors aren't listening to them, medical professionals, don't even want to go to the doctor, or just go if they have to. And if you don't have good communication with your doctor, then he can't really fully, he or she fully help you. So there's a lot more aspects to it. Let me just think for a second. I'll probably do more videos, because this just scratches the surface, but this is how you get a breakthrough in healthcare.